So it is 15-year-old girl who has brought to the annual checkup. He says the patient has always been a picky eater and he eats 3 meals a day. She used to stay up late talking to friends and go on bed after dinner. Blood pressure is 110/70 is fine and pulse is fine. It is 62. On breast examination, there is a TANF stage 1. TANF stage 1. Genital examination shows pubic hair consistent with TANF stage 4. The remainder of the examination is unremarkable. The patient's growth chart shows the height less than second percentile and declined growth velocity. So there is a 14-year age and next concept is very important is that TANF stage 1 and there is third important concept is the height less than second percentile and the fourth very important is declined growth velocity. What is the diagnosis? Okay. So our diagnosis in this patient will be which of the following diagnosis? The bone age is less than chronological age. That is a very important differentiating point. The fifth very important concept is the bone age is less than chronological age, which is the cause of this patient presentation. Okay. So in this case, our answer is growth hormone deficiency. Our answer is growth hormone deficiency. How? First, we will study this is actually a classic case of short stature due to growth hormone deficiency. Okay. This is a short stature due to growth hormone deficiency. Now we will study evaluation of a short stature in a children. Okay, how we can diagnose, how we can have a differential classification of a short stature in a patient. First of all, what is a short stature? Short stature is any children that is presenting on the growth chart that is height is less than second percentile. That is short stature. So in this scenario, we have seen that there is a height less than second percentile. This is short stature. Next, we have diminution. We will check that. Is there any dysmorphic feature? I will point out one by one question we will ask from the patient. That is very important. Step by step. First question we will ask, is there any dysmorphic feature? Okay. First of all, this will be the first question. Is there any dysmorphic feature? If there is yes, dysmorphic feature are present, so this is genetic disorder. Genetic disorders most likely have dysmorphic feature that present with short stature. Most common is the Turner syndrome. Turner syndrome. Next is the Down syndrome. Okay. And then is the skeletal dysplasia. These are the three most important genetic disorders that present with short stature and dysmorphic feature. Okay. Our next question, if there is no dysmorphic feature, that there is the no dysmorphic feature, so what will happen? Then we will check if there is impairment of growth velocity or not. Our second question is check the growth velocity. Growth velocity. This is our second question. The growth velocity is normal. Okay, growth velocity is normal. So we will go with this direction. Okay, this normal growth velocity. So growth velocity is normal. So what will be your third question? And if the growth velocity is normal, so what will be your question? Your question will be, is there any decreased bone age or not? Is there any decreased bone age or not? Very important. Here the question will be, is there any delayed puberty and decreased bone age? If there is yes, the decreased puberty and decreased bone age, our answer will be constitutional growth delay. But if there is a normal puberty, normal bone age, there is normal puberty and normal bone age and normal growth velocity, so what will be our answer? This is familial short stature. So here, make it so simple. The patient came to you. Okay, it is less than, height is less than second percentile. Height is less than second percentile. Your question was, is there any dysmorphic feature? No. Okay, there was no dysmorphic feature. And then we asked, what is the growth velocity? Is it normal or not? Growth velocity was normal. Then you ask the question, what is the bone age? It is decreased or not? The bone age is normal. This is normal. And this is also normal. So your answer will be familial short stature. Okay. What is familial short stature? In this patient, there is a problem there. The problem is that the parents will also be the short. The history will be familial history. Okay. One of the parent will also be short. Very important concept. In familial idiopathic or short stature, one parent will also be short. This is a very important concept. Normal bone growth, normal age, normal growth velocity, and only the short stature. That is familial. But now we will go with another concept. Okay. First, we will ask the second, less than second percentile growth velocity is the normal. But very important concept here is that there is decreased puberty and decreased bone age. What is constitutional? This is constitutional growth delay. This constitutional growth delay is that when a specific period of time, like you can say 6 months to the 3 year, 6 months to the 3 years, this is a period when there is decreased bone age, and that's why we can say this is constitutional growth delay. But is there any problem in this patient when the patient will be in adult phase? No. You can reassure the parents that this is a smaller period of time. This is a temporarily growth delay. For a certain period of time, this child will be normal, and of course, the child will gain his adult height. Child will gain his adult height. And in this patient, the parents are not short. Okay, there is no family history. Very important. So we have discussed in this short stature what are the normal growth velocity. So now we will go with our other side in which there is impaired growth velocity. Okay. Now we will go in which there is the impaired growth velocity. Okay. This is impairment of growth velocity. Now we will check short stature and impaired growth velocity. Then we will ask again bone age. Our question will be bone age. Is it is increase, decrease, or normal? There are three chances. Either it is bone age is decreased, bone age is normal, and bone age is increased. Okay, there are three scenarios. First, we will discuss where there is delayed bone age. Okay, delayed bone age. In this scenario, delayed bone age, there will be endocrine disorders. What are these endocrine disorders? These may be hypothyroidism. These may be growth hormone disorder. This is our scenario. Okay, our scenario is this one. Okay, it is, I have circled in the red line. Okay, our patient presented with short stature. Our patient presented with decreased growth velocity. Our patient presented with delayed bone age, and it was due to endocrine problem, that was growth hormone deficiency. Is that clear? So in the other differentials, if we can see, if there is a normal bone age, there will be a systemic diseases, and systemic diseases are celiac disease. Systemic disease is the celiac plus IBD, inflammatory bowel disease. This is normal bone age, but growth velocity is impaired, and normal bone age, this will be a celiac disease. Next very important point is, if there is increased bone age, then what will be our differentials? Okay, if there is the increased advanced bone age, this is the concept precocious puberty is the answer. Okay, so this is the evaluation of short stature. We have discussed one by one. I can summarize this in just 2 minutes. First of all, a patient came, you have to evaluate if the height is less than second percentile. If the height is less than second percentile, which you will see on growth chart, you have diagnosed the patient is a short stature. Okay, and next you will ask the question, is there any dysmorphic feature? Yes, if yes, then you can suspect Turner syndrome, Down syndrome, and skeletal dysplasia. You can suspect any of these three. If there is no dysmorphic feature, your next question will be, is the growth velocity normal or impaired? The answer is growth velocity is normal. You will go from this side. If normal, then you will ask, what is the bone age? It is decreased or normal? So if bone age is normal, then there will be a familial short stature, and you will see that one of the parents will also be short. Then if there is normal growth velocity, but there is a delayed bone age, there will be constitutional growth delay. There will be a specific period where the bone age will be decreased, but in adult height will be maintained after the age of 10 or 9. Okay, next we will go to this side. Okay, next, if there is no dysmorphic feature and there is impaired growth velocity, then we will have a three situation. If there is a decreased bone age, normal bone age, and increased bone age. If there is a delayed bone age, there will be the differentials of malnutrition and endocrine disorder. In endocrine disorder, we have the two most important, that is hypothyroidism and growth hormone deficiency. If there is a normal bone age, there will be a systemic diseases, systemic celiac diseases, inflammatory bowel disease. If there is advanced age, there will be very important, that is precocious puberty. Okay, so this was the overview of the short stature.